Well, it looks like nothing will stop those big federal budget cuts set to start tomorrow.
Those cuts will force some government workers off the job and reduce services for many Americans. Senate Democrats and Republicans killed separate last-ditch plans to block the spending cuts. A Republican proposal requiring the president to propose alternative cuts fell today to overwhelming Democrat opposition. Meantime, moments later, a Democratic alternative fell shy of the 60 votes needed to get past a Republican bloc. Automatic budget cuts in Washington could make a significant impact on health care across the state of Texas. The Health and Human Services Commission says the state's health system would lose nearly $84 million in funding. The trickle-down effect could reach local clinics, and KXAN's Angie Bevan has more on some of the services at stake.
4-month-old Zoe is a bubbly baby girl.
She kind of wants to talk already.
Her mom says she wakes up with a smile about every day.
She's so playful.
So Irma Hernandez takes the steps to make sure Zoe stays happy and healthy.
That's it. I know.
That means taking her daughter in for her 4-month vaccinations. Hernandez depends on the clinic at St. John's Community Center in North Austin for the proper health care for her baby. While still uncertain, automatic budget cuts at the federal level could impact services moms like Hernandez count on.
There are definitely some federal funds that come down to our local health department that will affect services were they to be cut during this process.
Dr. Wong says at the local level, cuts could impact immunizations, HIV testing, and emergency preparedness funds. For instance, addressing H1N1, pandemic flu, or setting up medical shelters like during Hurricane Katrina. From the most drastic of times to the most common of procedures.
That's it. No more.
I just worry about not having enough money to pay for her medications, her appointments at the doctors.
Ensuring Zoe is protected and prepared now and when she's ready to walk and talk on her own out in this world. In Austin, Angie Bevan, KXAN News.
Certain public health programs are not subject to budget cuts. That includes Medicaid and the Children's Health Insurance Program, or CHIP. Medicaid makes up about half of the federal aid states receive, but smaller programs with the state's various health departments would see some cuts. Here's a breakdown of the projected cuts from the Health and Human Services system. Department of State Health Services would lose nearly $59 million. Department of Aging and Disability Services would lose about $12 million. Department of Assistive and Rehabilitative Services would lose $2.5 million. Department of Family Protective Services would lose about $8 million, and Health and Human Services Commission would lose nearly $3 million.